Bone Pierce here at Broadway Tattoo Lounge in South Amboy. We've had a couple requests that people want to see a navel piercing, as well as belly piercing. Today we're going to do the belly piercing, show you exactly what to expect, how it should be done, and of course the proper aftercare. First step always, a couple things you can see. Okay, when you come up closer, is you're going to see a belly button ring. The standard belly button ring size is a 3/8. All right, most of the time you're going to pick something, you know, nice and shiny so it looks nice. These are going to be forceps right here. That's to hold the tissue together so you can pierce properly. Alcohol swab cork, 14 gauge. That is the standard size, and of course something to hold the jewelry with. Now, first thing we're going to do is we're going to clean the belly button and then mark it. Come over this way.
As soon as I start working on it, I'll be like, oh, I'm not hungry anymore.
Now, as you can see, you had your belly pierced before? Okay. If you can see a little bit closer, I guess. She's had this belly pierced before. You could tell right off the bat that it really wasn't straight, so it was a little bit crooked. There's a little scar tissue right there. So, in order to redo it, we're going to have to go behind the piercing channel. If you try to go through the same piercing channel, or if your piercer tries to go through the same piercing channel, it can migrate, and it's more prone to an infection. Going through scar tissue takes a lot longer to heal, so we're going to go through the same bottom hole, but we're going to go a little bit above that because it was a little bit too close to the umbilical area, and then we're going to go ahead and pierce behind the original channel.
It would have to be at least the width of that, you know what I'm saying?
Mark it.
It's an element here. Right.
You always got to make sure that this is straight. Even the slightest bit off, and the belly button ring will look crooked. Also, just so you know, just for a little bit of information for you guys, not everybody is suitable to get their navel pierced. A lot of people that have what's considered an outie, most of the time they're not really able to get their belly button pierced. An outie is a lot of umbilical tissue. Okay? If you try to pierce through that, it can cause internal bleeding. There's a lot of complications that could be involved with piercing an outie.
Bye, darling. I'll see you later.
Bye.
Huh? Yeah, I did this.
Go ahead, lay right here. First, we're going to pinch the tissue together a little bit. You're going to want to move that marker a little bit over. But we do want to maintain that bottom hole, since that bottom hole was centered. Now the belly button should not be painful whatsoever. It's one of the most least painful piercings that there is. Aftercare is pretty simple. Now these are forceps that I was telling you about earlier. Just take a nice big breath in, big breath out. One more time, big breath in, big breath out. Always make sure your piercer puts a cork on the end. It will prevent them from kind of poking the tip of your belly or this. Next step is very simple. We're just going to put the jewelry through. Put the ball on top. And there you have it. A nice shiny little belly piercing. I'm gonna put a little bit of aftercare spray in there, let that soak in there. Now, as far as the aftercare procedures for this, very simple. Get yourself a mild soap. Without sensitive skin, as always, is the best soap you get. You don't want anything too strong. All right, it'll actually prolong the healing process. When your tissue develops, you use something strong like alcohol peroxide, it's going to prolong that process. Okay. Aftercare spray, H2O is probably the best thing to always get. Use that 2 to 3 times a day. If you do some kind of activity where you're sweating a lot, such as going to the gym, any kind of sports or anything like that, wash it twice a day. Because when you sweat, of course, it brings all the bacteria down into your navel and it sits right there. So you want to make sure you keep it nice and clean. It's going to take roughly about 6 months to fully heal. At that time, if you want to switch it out with something else, you can do so. However, before then, do not take the belly ring out. Okay? That is your aftercare instructions. This is your navel piercing. Sean Pierce here at Broadway Tattoo Lounge. Have an awesome day.